So I've always had an interest in healthcare and helping other people, and pharmacy is a really good career to do this because we have an input in the healthcare team to be able to make clinical interventions, to be able to be part of making patient treatment plans, and just to be really involved in improving patient care.
I decided to do pharmacy at university because I really enjoyed doing science subjects at school, and I did all science A-levels, and then I decided that I was going to take a gap year and worked in a community pharmacy for the year. So I did my dispensing MVQ and became a qualified dispenser, and then applied during that year and started uni the following September.
I chose pharmacy because I have always been really into sciences, but I also wanted a way that I could apply that to helping other people, and just for me, staying in a lab was not really something I was as interested in, so pharmacy is a great way to bring that science out and to use it to help other people.
I really enjoyed chemistry and biology at A-level, and I wanted to continue learning about them further in university. I was really interested in going to university. I wanted a chance to experience living on my own, managing my own time, managing my work independently, separate from my parents, and just experience like that side of life. Because I wanted to continue sort of chemistry and biology, I had a look at biochemistry as well, but actually I realised that healthcare was where I wanted to go into, and I was really interested in how medicines worked in particular, which is why I chose this course.
So I did chemistry, biology, maths and music at A-level. I did 3 sciences because I knew that these were the kinds of A-levels that I would need to do a career in healthcare. And I did music because I'm just really passionate about it and it's just good fun, and I wanted to have a different kind of subject as well. I then went to Durham University to do my MPharm. The reason I chose Durham was because when I was looking around universities, I went to a talk which one of the lecturers was doing, one of the pharmacy lecturers, and he was just so passionate and so inspiring that that was what made me decide to do pharmacy at Durham.
The A-levels I completed were chemistry, physics and psychology, so all sciences and a social science, and I applied for university at University of Hertfordshire. The main reason I chose that university was because when I attended the open day, I felt most at home there. I really liked the way they did the course and everyone was so friendly, and I also did it so that I could commute to university and keep my part-time job in the community pharmacy.
Originally I took maths, biology and chemistry, and I also did psychology at AS because I wanted to study medicine. But then after going through the long process of getting into medicine and getting all the offers, that's when I started to have doubts, which is a bit late, but it was fine because on the day of results I ended up changing to pharmacy, and I've not looked back. I went to UEA, I had a really amazing time there, learned so much, and now I'm here.
I studied for my 4-year pharmacy degree at the University of East Anglia in Norwich. I chose that university in particular because I had a really good open day experience. I really liked the city, and because with pharmacy it's accredited, the course is very similar everywhere. It was more about your experience on the day and how you feel.
So placements are really valuable because they give you an opportunity to see different areas in which pharmacists can work. I had several placements organised by my university, which spanned across a range of different areas, including hospital, community, GP placements. We looked into industry a little bit by going around GSK, and I also went around a mental health hospital.
So throughout my degree, I completed several clinical placements, and by the end of the degree I had completed a community, hospital and industry placement, which meant that I knew mostly what was going to happen in any of those areas of the career, so it helped me choose which area I wanted to pursue in the future.
So placements at university are actually really good. About half of them are organised by your university, so you've got this guaranteed foot in the door in a lot of different sectors, and also they encourage you to go out on your holidays and get some extra placements, which is actually how I got my foot in the door in this hospital, because I worked there on my holidays for the past 3 years.
In my 4th year of university, I had the chance to go and visit a care home with a care home pharmacist, and this was the placement that I enjoyed the most out of my university experience. Basically really got to experience what they did, and it was a really good combination from my perspective that day of hospital and community pharmacy. You got to build a relationship with the members of the care home, see them on a regular basis, but also make some interventions, consult with doctors, and there just seemed a lot more input than other placements that I had experienced.
There are many different ways in which we are assessed as part of the course. These involve written exams, practical examinations called OSCEs, lab reports that we write up, different courseworks, and this is a really good way actually of showing transferable skills because you're being assessed in lots of different ways.
Assessments are quite varied. Obviously we can't just be book smart for this career, so there are a lot of theory assessments on paper, but we also have a lot of practical assessments where we practice talking to actors, giving kind of basic diagnoses or handing out medication, getting medical histories. It's very diverse, it's very exciting, and there is a bit of pressure. It is an exam, but you come out at the end of it and you know that you've actually gained a lot of knowledge.
I found my final year research project to be really rewarding. My project was on a new and upcoming area of healthcare called clinical informatics. So it was really exciting to be a part of the future development of healthcare and the future development of our careers as pharmacists. We wrote a 10,000 word dissertation, so being able to see that final project was really a highlight of my degree.
My favourite part of the degree was one specific module which looked at endocrinology and diabetes in particular. We had the opportunity to talk to some patients with diabetes about their perspective about the disease from how they experienced it as a patient themselves. We also got the chance to monitor our own blood sugar levels with the devices that they would use, which is helpful in terms of us understanding what they would have to go through, and in future if I have to counsel on this device and how to use it, it just gave us more of a sort of a well-rounded picture of what everything they're going through in terms of their treatment. We also had the opportunity to look at the different medication devices they use, and there were just many different aspects. It wasn't just sat in one lecture learning about the information. I really enjoyed that.
My favourite part of the degree is probably not what we're supposed to talk about, but actually the camaraderie of the degree was my favourite thing about it. It's a very work hard, play hard atmosphere, and so you're in there kind of 9 to 5 throughout the week with lectures and labs and things like that, but you make a lot of really good friends, you go out, you have fun, and I'm still in contact with a lot of people, so yeah, that was my favourite part.
My favourite part of my degree was the fact that in 4th year we were able to choose between 2 optional modules, mental health or travel health, and I chose mental health, and it was definitely my favourite module. It really prepared me for what I was going to see in my hospital pre-reg, so it was very beneficial to be able to choose between the 2.